Good afternoon, everybody. This is Robert Nelson from Pivotal, New Mexico. As you are entering into the room today, if you could, please mute your microphones before we start the webinar. We have a really great session today with the Alma Health Foundation, and we're joined by some wonderful folks, Nelsie Dominguez and Dennis McCutcheon over at the Alma Health Foundation. They did this last year with us, so we're really, really grateful that they would do it with us again. They have some slides that we're going to share with all of you, and kind of go from there. But again, just a reminder, if you could just mute your audio, that would be really helpful. And I invite you to introduce yourself in the chat. So your name, your organization, your pronouns, and maybe what you're hoping to get from today's webinar today too. So once again, yes, one more time, just mute your microphones as you're entering into the Zoom room today. And if you could just introduce yourself in the chat, your name, your organization, your pronouns, and what you hope to get from today's webinar. And with that, I will pass it to you, Nelsie. Is that all right?
That's perfect. Hi, good afternoon. I see some familiar faces. I really appreciate all of you for joining. Welcome. As Robert mentioned, this is Alma Health Foundation Pre-Proposal Workshop. I'm Nelsie Dominguez, Program Director at Alma. And on behalf of Alma and our host, Pivotal, New Mexico, we're delighted that you have joined us. We have a terrific turnout from the region, as well as some folks from other areas of the state. And as I mentioned, it's great to see many of the familiar faces and the names, and as well as new ones. I am joined today by also my colleague, Dennis McCutcheon, and he'll have an opportunity to also present alongside me. As you can see, we have an ambitious agenda to cover in an hour and a half. This means, forgive me, I thought that was on mute. Oh, the joys of Zoom and multitasking. We have an ambitious agenda, and this means really that we'll be moving fairly quickly through a lot of information. For that reason, we will be recording this session, and you will be able to return and revisit any detail at your leisure. I believe that Robert will be sharing this on Facebook, as well as we will have it up on our website as well. So during our time together, we will be briefly touching base on some essentials about Alma. We'll provide an overview of the guidelines, the grant cycle, the application. We will also give you a quick look at Alma's grant portal and more. We will show you easy ways to find relevant grant cycle information. And soon after the session, as I mentioned, we will have the PDF of the PowerPoint available to you. As I move through the presentation, I'll pause to learn if you have any questions. Additionally, we will have a Q&A before we say goodbye this afternoon. So without any further delay, I'm going to pass the Zoom mic over to Dennis, who will get us started.
Good morning, everybody. As Nelsie says, this video will be available. The slides will be available. I will post a link to where they will be downloadable on our website. And we will also go over that a little bit later in the presentation. You've already, most everyone has introduced yourselves in the chat. Thank you for doing that. If you have any questions that you want us to address, please do use the chat. And also, as Nelsie says, we're going to be stopping periodically, and you can use the chat or just unmute yourself or raise your hand or however you like to do that. We will get your questions that way. If you have any technical difficulties this time around, tag Robert. It's their chat this time. That's their Zoom. And so that's it for right now. Thank you all for joining, and talk to you shortly.
Thank you, Dennis. So we'll start with CONALMA's mission. And as you can see, CONALMA's founders had an expansive view. They created the foundation to be aware of and respond to the health rights and needs of the culturally and demographically diverse peoples and communities of New Mexico. While the foundation fulfills its mission by engaging in a wide range of activities that go well beyond grant making, we do so with a lens towards improving the health status and access to healthcare services. We also support and advocate for health policies that address the health needs of all in New Mexico. CONALMA defines health broadly to include aspects that go beyond healthcare and includes areas that impact our health, such as the economy, environment, education, and more. CONALMA is considered a health equity foundation. There are many reasons for this, including our organizational structure outlined in the bylaws, our diverse board and community advisory committee representation. And by the way, Robert Nelson is on our community advisory committee. Thank you, Robert. Our attention to social justice and who we serve and the values we seek to incorporate through our work. As noted on this slide, we prioritize the uninsured, underinsured, rural, frontier, and tribal communities, as well as people of color. The foundation values community self-definition and self-determination, which simply means we look to community stakeholders to identify existing gaps, opportunities, priorities, and the solutions that best works for them. We looked for efforts that are systems focused versus those that provide direct services to individuals. The one exception has been CONALMA's recent effort related to COVID-19, wherein we have been able to award over $1.2 million in emergency relief and direct assistance to underserved populations most affected by COVID-19 pandemic throughout New Mexico. Some of you have been or are recipients of those grants. The current grant cycle opportunities, however, are about systems work, improving social conditions, or endeavors that support the nonprofit sector and community-based efforts in New Mexico. We greatly emphasize cultural and linguistic alignment and engagement of networks across sectors and issues to amplify community voices. Now, I realize I'm using a number of concepts that might require additional explanation. And for that reason, we've included links to key documents throughout this presentation that you can access at any time. These documents are also available in other easy-to-find places, and Dennis will walk you through some of those a bit later. We currently have 2 open grant cycles. The focus of this pre-proposal session will primarily be the CONALMA annual grant cycle, although I do so by showing a side-by-side comparison of the 2 grant opportunities in case there are organizations that focus on the 3 counties specific to the Northern New Mexico Health Grants Group grant cycle. These are Los Alamos, Rio Arriba, and Northern Santa Fe counties north of the city of Santa Fe. As you already noted, the current, or as I already noted, the current grant cycle opportunities are focused on systems change, such as efforts that look to improving health conditions through, for instance, ensuring access and addressing the systems or root causes of health inequities, such as barriers or priorities identified by the people directly affected. Now, because we understand that to succeed, we need a strong community voices, effective organizations, collaborations, or alliances. CONAMA also award grants towards building the capacity and infrastructure of New Mexico's nonprofit sector, including health impacting safety net organizations, advocacy and policy efforts, collaborations, and networks. Now I'm going to stop there because that was, well, actually, one more thing. This is how you actually will be looking at that contrast between CONAMA Health Grant, right, and Northern New Mexico Health Grants Group. And so diving in more detail on available grant cycles, you can see that there are elements that are common to both. Some components that are specific or more prevalent in one fund than the other, I'm going to tease out during the presentation. One obvious one is locality, with the CONAMA Health Foundation awarding grants throughout the state of New Mexico, and the Northern New Mexico Health Grants Group limited to the 3 counties that I mentioned. I will point additional similarities and differences as we go. Now, I would like to stop there because it is a lot of information, and just check in to see if there's any questions that have come up, either in the chat or if you unmute, you can also ask. Are there any in the chat yet?
No chat yet.
Okay. And I don't hear any, so I'm going to go ahead. So here is a cut and paste of the actual guidelines that you have available to you. The commonalities here are easily to spot once again. There's access to both grant applications, which close on April 30th at midnight. Grant applications received and reviewed this year, if awarded, will be available for implementation next year. This is important as you plan the scope and activities of your proposal. Another thing that is the same for both is the amounts available. And you can see that the amounts range from $7,500 up to $20,000. Now, the focus obviously differ, with CONAMA's being specific to health systems strategies. Remember that CONAMA has a broad definition of health, so the scope and impact of these grants address not just what is traditionally considered within the realm of health, but also conditions such as neighborhood conditions, environmental degradation and conditions, and barriers to housing, education, and root causes like poverty, bias, racism, and other things. Northern New Mexico Health Grants Group, on the other hand, looks to support efforts related to health and wellness in the 3 counties. These grants tend to be somewhat more flexible with regards to the distinction between systems work and direct services. I highly recommend a quick review of the descriptions of grantees available on our website under these 2 grant funds to get a sense of what has been funded in the past. Now, while both opportunities allow for organizations to request project, general operating, or technical assistance capacity building support, CONAMA's process is much more defined, while Northern New Mexico Health Grants Group is more general. See what I mean in just a moment. Now, keep in mind that an organization may only submit an application in consideration of one type of support. However, you can apply to both CONAMA and Northern New Mexico Health Grants Group if your efforts are within the designated counties. And organizations with current active grants can also apply. There are some documents you will need in in submitting your application. Now, these are, for instance, you'll need to upload an the organization's most current annual budget. If you're seeking a project or technical assistance support, you'll be required to complete a budget using the online available budget template that you can find in the grant portal. If you are working directly within the geographic jurisdiction of a sovereign nation, you'll need a tribal support letter that can be uploaded at a later time. You have till June 1st to upload that. And if you need additional time, please contact me directly ahead of the June 1st deadline. The organization annual budget and the project budget need to be included at the time you submit your application. Access to the application is through CONAMA's grant portal, as I mentioned. I'll touch base on that in just a moment. I'll actually hopefully walk you right through it. Most eligibility and restrictions are the same across the two funds, with the one key exception mentioned related to geographic limit of northern New Mexico and the Alma's Health Foundation statewide focus. Please review these eligibility and restrictions carefully. They really are the essential do and don'ts of what you can apply for. For instance, you have to be a 501c3 organization that is federally recognized. However, if you do not have that designation, you can still submit for consideration using a fiscal sponsor, and I'll touch on that a little bit later as well. Now, all grants must be awarded to benefit people living in New Mexico. So that is very important. Now, with regards to restrictions, just to give you an idea, and you can see it on your screen, hopefully, we cannot fund any kind of political campaign, lobbying activities, or any partisan activities whatsoever. However, because we are looking at social justice issues and because we are looking at health equity, the work of organizing, the work of building the capacity of community to have a voice, even to engage in conversation and provide their lived experiences to those that do have the power to make decisions, is an important aspect that you can apply for. As long as we're not funding the actual lobbying, the actual communication with a legislator, the building up of that capacity and the training and the engagement, we definitely can. And there's other things that you need to take into consideration as well. So here's the piece about the fiscal sponsor. As a private foundation, Alma can only make grants to federally recognized 501c3 nonprofit organizations. If you do not have that designation, you can still apply. This is something you will need to arrange on your own ahead of starting an application, because you will need to access the fiscal sponsor's EIN number. That is their employer identification number, also known as the federal tax identification number, their annual organizational budget, and they will need to okay the submission of the application and authorize the grant agreement and the final report if you're awarded a grant. Included in the guidelines are step-to-step how to set up the grant portal information. But in this presentation, I'm actually going to take you through some of those steps, but you can refer to the guidelines for that as well. Now, the guidelines also have an addendum, and they include important information regarding how best to frame and approach the submission of an application, as well as information that distinguishes the differences between types of application you might submit. A popular one is the request, of course, for general operating support. However, please keep in mind that organizations that provide direct services are not eligible for consideration under this type of award, because CONAMA does not award funds towards direct services. Now, CONAMA provides grants to organizations that both are seeking technical assistance and that provide technical assistance to others. Please read this section carefully, because there are elements important to your request that, if missing or not addressed in the application, will determine whether that application is compelling or not. For instance, you'll want to make sure to address how you plan to engage in the learning component. CONAMA looks for efforts that actively engage in learning versus passive learning, where you might have a contract or engage a consultant to do something for you. Here's another area of the addendum that might make a difference. This section includes elements of successful applications. We all seek golden nuggets of wisdom, right? They are found here. Our website also can be a place where you can find so much more. There are pre-recorded segments that focus on key aspects of CONAMA's grant process and that go into a lot more detail. And of course, the guidelines have links to this and other key documents. Lastly, the addendum to the guidelines include what to expect after you submit your application and provides a visual of the timeline you can expect. A big difference in terms of what to expect between the two funds is that CONAMA's process includes a site visit. We're conducting those virtually at this time. As such, applicants to CONAMA will hear from staff sometime in June whether they are invited to a site visit or whether their application will unfortunately not be further considered. Now, many of you may have submitted an application in the past that may not have been successful. Please remember, the bulk of applications we receive are really fund-worthy. Unfortunately, because of limitations in the number of grants we're able to fund, we have to deny many of those otherwise worthy applications. That's why making and ensuring your request is as aligned with CONAMA and as compelling as possible is truly important. If you apply to the Northern New Mexico Health Grants Group, or if you are invited to a site visit, you will learn whether you are awarded a grant or not in late October or early November. The award, and I mentioned this before, is made available for implementation in 2022. And this circle on both of these gives you the different stages that your application will be vetted through, and then what occurs after that, and you are awarded a grant. Now I'll stop there again. And once again, I'll ask whether there are any questions in chat, or if you want to unmute yourself and ask any questions related to what we've covered so far.
We've got a couple, Nelsie.
Okay.
The first off, can you define direct services?
Can I define?
Direct services.
All right. Well, that's a great question. We get asked exactly that question or other variations, and the answer is, if you're providing healthcare, if you're providing behavioral health counseling or therapy, that is a direct service provision. The healthcare industry is an example of direct care provision. We don't provide funding for you to do that type of work. What we do provide funding and a healthcare, an organization that provides that kind of direct support, direct healthcare, can apply to us for other things. You can apply for us if you provide that kind of care for a whole slew of things. How to expand that work in an area of New Mexico or of a community that otherwise have had barriers of accessibility. It is the component of expanding your program, not the direct services that it provides, that we would support. You can ask or submit a proposal. Perhaps you're working in a team or a coalition, and you provide a certain expertise, and there are others in that collaborative, and you might be seeking to strengthen that collaborative, strengthen the work that you do together, the visioning work, the policy work. Again, just because you provide direct services doesn't mean that you can't apply to us. It just depends on what it is that you're asking us for, how you're going to use the resources that CONAMA provides you. And there's a slew of other examples that you might look to our descriptions online for the kinds of support that we have provided in order to make the work that you do stronger and more efficient, and to support accessibility. So I hope that kinds of answers. So much of this, when you apply, depends on how you frame your request and how the scope of what you're asking CONAMA to pay for, to cover, right, under your budget, whether that is within it's aligned with the foundation. I hope that was helpful. Any other questions?
I'm going to jump to the hands up because a lot of times hands up is related to what you're talking about.
Okay.
Go ahead and unmute and ask your question, Ippy.
Thank you so much. Thank you so much for this opportunity, and I appreciate this kind of Zoom meeting. My question is this. Our organization is called Family Center Prayer Battle. And what we do typically is that we stay at the community center when it was open to pray every Friday. And when we finish praying, because of the need we see in the community, personally, I'm a pharmacist by profession. I'm a doctor of pharmacy, and I'm a nurse, and I'm a public health provider. So what happened is I started doing what we called Ask the Drug Expert. And in As the Drug Expert, what we do for the seniors was that we are doing their polypharmacy, because you see most of them taking a lot of medications, and the ones they're supposed to take and the ones they don't supposed to take. So that is what we do for them. And actually, to be honest with you, that is what drives me to go and do public health, because they ask their question about medication and drug interaction. And then because I'm not a food expert, I went ahead and did my public health and did do concentration in nutrition. So I'm now more equipped to help them. And this is a dying need that my heart goes out for, because if you look at our health system in general, we rather treat not that we don't, but some of the time, because of so many medications and some people are growing older, they come in with so many uncle and aunties of health disease as they grow. So people give their medication as you see their specialists, but nobody sits down and look at all those medications and see which one is having drug-drug interaction. This is a particular niche that my heart is burning for it. So when that happens, they go to the emergency. They will be given another medication to take care of side effect of medication. It's called bad medicine. Yeah. And it burns my heart, and it drags me into having a clinic and talking about polypharmacy. So now that you're talking about direct care, will I consider it as direct care, or how do I consider it? How do I apply? Because that is what brought me here. I have to be honest to you.
Yeah. No, thank you. Thank you very much. And I totally get that. I had until very recently, two elderly parents. And yes, I understand from my lived experiences. And my parents speak another language, and it's yeah. So let me ask you this, because I get what you're doing. I hear your passion, and it's very needed. No questions. What would you be asking CONALMA to fund?
Actually, I'm new to this because I saw that, and that is why I present it, because how do I approach it? But yet the need is there. There is a big vacuum. It's not that it's not known. It's known, but who will sit down and take that and do that? It's like,
and who does it? Yeah, and who does it in a culturally, linguistically significant and appropriate way? That's another area of this. So here's the thing. If you apply to CONALMA to do what you just described, it would be outside of our guidelines because it's providing direct services. You are doing something with community members in actually doing it. However, if what you need to do is build the awareness in the community of this issue, work with other nonprofits, work with providers in the community, clinics, whoever, in building their awareness or providing them with support to understand the challenges, that we can do. If what you're doing is setting up the program.
Sorry. No, I don't want you to go far. Then I forgot my question. My question is this: what I can ask CONALMA to do for me is to support me to build awareness for this. Is that correct?
Yes, the awareness and the outreach.
Awareness, okay.
Awareness and outreach would be aligned with CONALMA, and especially if you describe the population, describe the barriers and the opportunities to work with others to really address this, because this is a systemic problem. This is a policy problem.
Yes.
And here's the difference again, going back to the previous question.
Yeah.
When you
Can I say something, please, ma'am?
Of course.
So you said build awareness and outreach, the target population, and what again?
What did I say?
That's why I was interrupting you, because I'm sorry.
If you're engaging the population, and you are bringing up the issue of the barriers that they face, whether it's linguistic or culturally,
barriers, linguistic,
but listen,
cultural.
I don't want to put words in your mouth. You have to think about what those are and then be able to describe it. What I can do, and I share this with anybody that would like to submit a paragraph. It's one of the questions that you will, actually, it's one of the first narrative questions you come to, and I'm going to go through that, which is the application summary, a synopsis, right, of no more than 100, 150 words. If you can describe your project, your program, and what you're asking CONALMA for, I can provide you feedback directly like we're doing now, but I can't take any more time. I would love to, but I need to.
Thank you. You've done so much. Thank you.
Of course.
I don't want to take people's time too. Thank you.
Yeah. Send me an email.
I will.
And then we can and again, this is available to anybody. However, please don't wait 2 days before the application is due, because I may not be able to get back to you, and I don't want you to miss the opportunity of actually applying. And that holds true for anything, even dealing with the system and needing assistance to navigate it. Don't wait till the last minute, because we're a small staff. We're only 4 people, and only 3 of us actually are able to provide the kinds of support that you might need. So,
okay.
Thank you. Is there any, actually, before I run through, is there any other questions that I can attend to at this point?
Yeah, we've got a few questions.
Okay.
What's the ratio between how many applications we get versus how many we hope to award?
That's a great. Well, we get over 100 and some applications. But this is across everything, across Northern New Mexico grants group, as well as CONALMA, in all those 3 categories that I mentioned: project support, technical assistance support, and general operating support. 130 is usually 140, 50 or so. And in Northern New Mexico, we do between 20 something and 30 something grants every year, more or less. And then with CONALMA, we do, actually, if you go to our website and look, and Dennis is going to show you how, you'll see actually how many are awarded. But what I will say is we tend to keep, because CONALMA does the site visits, we tend to do no more than 50 site visits. In the past, we've done more, but it's too much. So what we do with CONALMA is really, it begins to be almost a 2-to-1, 3-to-1 likelihood that you would be awarded. But that's after dwindling down maybe 60 to 80 applications down to about 50. So there's always that, that we just have to do that. And we give out, what would you say, Dennis, about 60 grants a year or so?
Yeah, that's between the 2 grant cycles, yeah.
Mm-hmm.
What do you mean by site visit?
Site visit. That's a part of the vetting that we do. See, we have a community advisory committee as well as board of trustees that are from all throughout New Mexico. And both members of the board of trustees as well as community advisory committee members are part of our grant making committee. And that committee, along with staff, conduct the site visits. And simply what it is we invite organizations, as I said, no more than 50, and we visit with them. It's an opportunity for the organization to tell us more about the application that they have submitted. We have certain questions that we ask across all of our site visits. We do it in about 1 hour and 15 minutes, and we visit with the executive director, a member of the board of trustees or board member of the organization, and perhaps a program person. If you have a lead partner in that submission, in the application, we would love to have them participate. But truly, it is a way for us to take what's on paper and make it so we understand it from the perspective of those that are applying. Any other questions?
Can we get the budget template in advance for the organization budget or project budget?
We don't have a template for the organization. I could tell you what the elements are, but you should have one. Any organization, even when they're not a 501c3, a nonprofit organization incorporated, should have a budget. With regards to the template for the project budgets, that's where we're going next. I'm going to show you what those are. I don't know exactly what time it is, but perhaps we can, any other questions that we might have, we can leave to the end, because I may even answer it as we go. Is that okay?
Yeah, I know that you'll answer at least one of them.
Okay, and we can circle back. So let me take you right to a couple of things, and this is really about shifting a bit of the focus. So I want to take a moment to review CONAMA's fairly new grant portal. It was launched at the beginning of this year, and we're learning how to navigate it and use it, both staff and anybody that comes to it. So we're in this together, so to speak. One important aspect of the system is its flexibility. It also can make it a bit complex to initially understand. For example, there are two distinct components or areas of the system that hold different but related information. There is the organizational profile and an individual profile. The individual profile, as you can see from this rough schematic, can relate and play different roles depending on relationship. An individual can be, for instance, in a role of organizational contact. That means it's the person that is the lead for the organization, maybe their executive director, but not be or could be the actual person that is the lead for the application or the grant if you are provided a grant. Or it could be the individual that is named on a past grant, right? So additionally, an individual through their role in that organization may be connected as a fiscal sponsor to another entity, a project that doesn't have their 501c3. And so there's different ways of engaging. The organizational profile, on the other hand, is where you will find the organization's mission, their EIN credentials, the amount of its operating budget, their annual budget, and the diversity table. And I'm going to show you what that is in a moment. In addition to being your door to the application, its drafts, whether you're funded or not funded, there is links available for the actual grant opportunity that lives in the grant portal. You'll see funded grants. You'll get communication from the foundation through the portal. And there's other resources you can access. And there's a list of many of them that you can actually go to. Once you get a PDF of this, you can actually hit any one of these, like for instance, the type of organization, and it will open up as a PDF, and you can review that. This gives you a lot more information about the specific different types of requests. Or you can go to the regions map. Oh, it tells me you can't. I won't worry about that. We'll have to see why that. Normally it just opens up. This is the first time I've had a challenge. All right, so next, let me stop there. Any questions about oh wait, you know what? What am I thinking? I'm going to take you to a Grand Polo. This is going to take a moment, and it's going to have me. And it requires me to do this. I had it open before, but it goes to sleep. So I always have to log in. Now, when I first log in, what you're gonna view is my view, which is different than yours. I have other role and other responsibilities. And so you're good. We set up a template. Make sure I get the right one this time, right, Dennis? It's this one. And what I'm going to do is I'm going to emulate or show you what it looks like for somebody who comes in to the system, an applicant like yourselves. So this is what you would look. Now, this applicant happens to be very, very busy, as you can see.
Now
They
see,
have, yeah.
it's not showing that. It's showing the slide.
Oh, let me stop and thank you for telling me. Then all that stuff that I was doing didn't show up. Let me see what I can do about that. Hold on. We're there. Can you see that?
Yep.
Okay. So this is a make-believe nonprofit. And what I was saying is that this individual has already a lot of activity going on. He has 7 grant applications in progress and has a whole bunch of approved and declined ones. So you can view all this stuff, but where I want you, and especially if you're brand new, what you want to do is first set up your personal profile as an individual, and then go and open up or create an organizational profile. But for this presentation, I'm going to go to the organizational profile first. And I'm going to show you that this organization, it's not completely filled out, but you can see that under the principal officer, that's the main person responsible for the organization, you put that information on, and then there's tabs that you can move through that has different information. This is the organizational info related to the year it was founded, and when your fiscal year ends, and then the budget for the entire organization. You would put the amount here, and this is where you type in what your mission statement is. It also allows you to tell us what the main activities and services that you provided as an organization, not what you're asking CONALMA this time around. It also has an area for geographic information. And again, this is about the actual organization. And you can identify where by clicking the different, the drop down like that, and tells us where the focus is. So in this case, we saw Lee County, which is right there. So you can just check or uncheck for as many as applies, right? Now, I mentioned earlier in my slide that one of the things that the organization area contains is the diversity table. And here's the diversity table. You can view it, but you can't change it from this place. I'm actually clicking and it won't do anything. When it's something like this, you have these purple buttons, and those purple buttons are really important because they allow you to open other items. And what you want to do is make it as big as your screen. And here now you can actually type in what it is that to provide us information about the demographics of your organization. Now, quite often, most nonprofits have board of directors and has executive directors and staff, and may or may not contract and have volunteers. So you just fill where it's appropriate. However, there are some organizations we know that do not have paid staff, or in the case of organizations that are not formal in their projects and are using a fiscal sponsor, this diversity matrix, it's about um, the project that is coming to us for resources. And so if you do not have paid staff, what you might want to do is then put them under the volunteer. So that would mean these areas here would be nothing, but you would then inform us with regards to the volunteer area. And one of the things that's really important whenever you open up this kind of page is that you want to save, always save before you X out, whether you close it here or you close it with the X, because if not, whatever you're working on won't be saved. So you want to save, and now you want to close that window. And you always go back when you're done completing all the organizational stuff. You always want to go back to home key. See, it gives me a reminder because I made some changes and I didn't save it. So before you move anywhere else, the system will remind you that you want to save whatever changes you've made. And now it lets you go to the home.
Nelsie, before we go farther, there's a couple questions that I think are good for right now.
Excellent.
So I'm going to go backwards in order. So the diversity table is not on the parent organization, but the project program being submitted.
The diversity information lives under the organizational profile because it's about, we want to know what your organization, what the individuals of your organization, what their demographics breaks down to. So we want to know that. And so it is under organizational profile. And if you remember, it's under additional information. And that gives you access to that diversity.
And then the next.
Okay.
I'm the one that asked that. I'm sorry.
Don't be.
Because this is good, because I did apply. By the way, I'm glad that this is the system that you use, because that's the one I applied for in November, we got funded. But my question is, it was not too clear. So we have a parent, we have a fiscal agent or the parent institution, and then we have the program that has its own staff and volunteer and staff, paid staff. Which do we do the diversity table on? The program staff and our program, not the institution, the parent, right? That's what I need clarification on. Because I think before it may have been submitted by as the big organization. We're under the University of New Mexico, so we're under, it would be, UNM Foundation would be our fiscal. So is that the demographics you want, or do you want our demographics?
We would want your demographics.
Okay, that's what I thought.
In the case where you're using a fiscal sponsor, we're not asking about the fiscal sponsor. We want to know who are the people that will execute, if you will, the program. And so that's a wonderful question. So if you're using a fiscal sponsor, we're not asking about the diversity of your fiscal sponsor. We're asking about the diversity of, in this case, a program, a department within, right? A program of. Great question.
Elba. Yeah, Elba, do you want to ask the prior question?
Yes, so the other thing was just making sure that, again, back to the organization, because I think we may have made an error at the beginning and then we go correct it. Just want to make sure. So there is still, there are two paths. If it's the fiscal agent or the sponsor, right? Or fiscal, and then the program. Yeah. And I guess I was trying to figure out when you said individual and organization. Where would that, to follow segue to that, where would I put in the information?
That's where we're going next. So I'm glad you asked.
So because the idea was the the organizational profile, or is there a specific area where the fiscal agent or information, like we have their budget and all that we have to upload?
That's where we're going.
Oh, wonderful. Okay.
So, absolutely. I just want to check in though. I think we might be running a little late. If I notice, are we supposed to stop at 3:00?
No, I think we have till 3:30.
Okay, good. Then we have plenty of time. I don't want to cut anybody off or not be able to finish this. That's perfect. So once you created your profile, and once you created the organizational profile, these two things, first you do this, and then you go here and you create that. You want to know what funding, and you want to start an application. So right here is where the funding opportunities portal is. And it says 7, but as you will see, that's because there are 7, but many of them are already closed. That deadline has passed. And in some cases, it doesn't even, it has passed. So these are the 2 that are available. And one is the CONAMA and the other one is the Northern New Mexico. In this case, I'm going to open up the apply now to CONAMA. And the first thing that the system will ask, and we call it a quiz, but it's only one. It asks you whether you are a 501c3 incorporated organization or not. And let's say you're not, right? Just like Elva, she's going to be fiscally sponsored. So you're going to say not an eligible 501c3 organization. Now, you have 2 options, either save or submit. This is the only time that you will actually submit rather than save. You can save. It doesn't do anything. It just saves that you're not, but it doesn't do anything. You don't go anywhere. What you want the system to do is to generate that application so you can complete it. In order to do that, you actually have to submit. Once you do that, you're in the grant application. This is where all of your questions are. And because we told the system that we were fiscally sponsored, the first thing that comes up is information about your fiscal sponsor. This is where you put in the name of that organization, their EIN number, all of that information, right? And you want to save. And then you go to the application information. This is where you put the request type. This is where you put that summary I spoke about. This is the request, a clear summary of what you will do and accomplish if this is funded. This is the piece that I was saying, if you want to send me this, you have up to 150 words. And if you want to send that to me ahead of submitting the proposal, go ahead and do that. Don't wait till the last minute. I will review and I will get back to you. And all I will tell you is that's perfect. It's well aligned with CONAMA. Or I'll say, that reads like a direct service, or it leans towards direct services. You might consider, and then I'll give you a suggestion if it's included in there. If you're talking about something or other, and I can pick up on that and say, you might want to make that stronger just on this paragraph to make sure that whoever's reading this gets that you're not asking support to do the direct service, but you're asking support for X, Y, and Z. So anyway, this is where you would say, let's say you're asking for $10,000 and you want, let's say you're doing health promotion, just like the lady I spoke to previously was doing. And other things is culturally appropriate, making sure that the health promotion is culturally appropriate. Type of funding, let's say this individual asked for project support. And then we ask you to explain, why do you choose that? Why is it this the most appropriate? So you will be able to address that. And then all of the other questions are all listed here. The other thing that you will be able to do and have access to is you can just go like this and go all the way up, right? And copy this and put it in a Word document. And actually in Word, type all of your answers. And only when you're ready to actually submit, or when you have crafted what you want to say, do you want to dump that information in here? You can cut and paste from your Word document into this. The other cool thing about this is that as you type, hopefully with better spelling than that, right? The word that are left begins to decrease, and that tells you when you've reached the 150 word limit. So that's kind of nifty. I'm going to actually save whatever I've made, any changes here, and I'm going to go to the geographic information. We provide you an area where you can actually provide a narrative with what you're trying to do. Again, this is about where you're asking CONALMA, right? This is the application, which is different than the organizational information that we just went through. Here, we ask two types of geographic information. We ask about the range of the work that you do. Let's say this individual is out of Bernalillo. That's the primary. Their offices are in Bernalillo, so that's your primary area. And what other areas or counties? And you might be also doing work in Valencia County and Sandoval County, and as well as Bernalillo. And you see, it's really simple. You click in and out of these. The other thing that we ask is the impact. Because CONALMA is looking for systems work, the impact might be much larger than where you're actually doing the work. So, for example, the case where someone is doing work around medication and the outreach, making sure that providers in the community understand how to access medication, how to coordinate their own medication and all that. And you happen to have expertise in Spanish and 3 other languages, right? You might be able to provide that information to other nonprofits or make that information available to clinics around the state, maybe a video. I'm just making this up. But the impact of that may not be just in Bernalillo County and Sandoval County. If you share it with a network, it might have a much larger impact. So this is where you can say, my impact can be other counties. Let's say you have a really strong partnership with someone in Doña Ana County. You can put that there. And other counties. And the difference is, again, where you have people actually working, an office and other work in the community, and then where the impact will be felt. And you want to think about those two. We also have an option in the impact only with regards to having an impact statewide. This is often the case if you're working, again, around policy. The New Mexico Law and Poverty Center is a good example of, they often have a statewide impact, even though they're located in Albuquerque and they provide their services across the state. But most importantly, as an example, they were pivotal in pushing the state to look at the guidelines around benefits and making certain things that were happening in the state with regards to uh, benefits and looking and what is that word? Uh, Review of whether someone could apply or not, whether they're eligible or not, their eligibility process. They actually had input in shifting that, in changing the way the state was doing that. And so that had an impact across the state. And you can state that, and you can make a case for that here. All right, so then we're going to go to
Nelsie,
what you were asking. Yeah.
while you're there, there's a question related to impact.
Yeah.
So for the Northern New Mexico Health Grant Group, would it be good to still show the potentially broader geographical impact despite a focus on Northern New Mexico?
That is a very good question. And the answer, believe it or not, it's really not. Because those funds are very specific to those 3 counties. And in one case, it's even a part of the county. It's not all of Santa Fe County, but north in Santa Fe County. You want to really focus on that. Now, you can say that if you're working in along the lines of changing an administrative policy, such as the example I was giving, that will have a greater impact. You can say that, but I wouldn't spend a lot of time on that. You can check in, and it's always wonderful to hear that. But again, where you want to focus your activities and the true impact and all of that is in one or in all 3 of those counties that are limited and focused on. Great question. All right, so I'm going to go to budget. So here is the budget, and you don't see anything. That's because you got to go to that small purple button that opens up a different window. And once you open it, now remember that you mentioned in that first area that you were going to ask for 10,000. You want to make sure that's the same here, okay? Because this is how you're going to build your budget that you're going to submit to us. And part of what we want to do is already the 10,000 is populated. It just comes from the system once you put it in there. And we know that is, it's pending. It's not secure. So it's this area here you can't even go into. But let's say you have another 10,000 from some other or a couple of other New Mexico foundations, and only part of it is secure. And so you may say receive from X, Y, and Z. Oh, actually, it doesn't let you do that. Never mind. So this shows us that 50% of that projected funding is already secured. And by secure, we mean you have an award letter, okay? And you might have, let's say, another 20,000 from an out of state, and only 15 of that is secured. So your total budget, you don't have any of these other things for now. And this is specific to the project that you're asking us. It's not for the entire organization. So this project requires $40,000. It may require more, but right now we're going to go with the 40,000 because it's what you have. Of the 40, half of it is secured. And that's something any funder would want to know. You know, how much does it really take to do this project, and how much of that is actually secured. So let's say that out of the 10,000 from CONALMA, you're asking for, 5,000. This is where you build the expenses. How are you going to use those resources, or where are those resources go? So you're going to ask from CONALMA what share well, actually, let me do it this way. Let's say it takes $10,000 for the staff, and 5,000 is what you're asking Konama to cover. And that's part-time, if you have whatever breakdown you want to do. And if there's benefits, you can put that in there too. For now, we'll just say it's simple. Now you have some contract work. Matches your total projected income and your 10,000 that share of Konama or greater than 100. Where? Oh, because I left that like that. I didn't mean to do that. Just simple to X out of that. Now it should let me save it. All righty. That's the budget that we will see then. See how pretty? Now you can close it. Now, with regards to attachments, this is where you upload the annual budget, your operating budget for the organization. This is for the entire organization. In the case of a fiscally sponsored organization, this is for the fiscal sponsored organization. And you might ask, why is that? Well, we need to make sure that that organization that's fiscally sponsoring you has the capacity to do so. So by looking at their annual budget, that tells us so much. It tells us whether they have the capacity financially to oversee somebody else's program fiscally, and whether they have the structure to be able to be a fiscal sponsor. So this in here, you are uploading the organization annual budget, or if you're fiscally sponsored, then the fiscal sponsor organizational budget. In this tab is, yeah.
Before we leave budget, can we get to some budget questions?
Yeah, of course.
Yeah. All right, I'm going to go from the bottom up. What if you don't have any other money to expend on the project, but you are asking Konalma, is it okay? And I think that came up, that was Elba. Do you want to clarify that? Elba, go ahead and unmute.
Yeah. So thank you. So if you could go back to that, to the budget.
I will.
There. So again, so the program under this parent organization, we have also multiple grants for different activities. But the project that we would ask for Congalma to fund would be specifically to that. So in the revenue projected, do you want to see our other grants for the whole program? Or do you want to just see what we would contribute to that specific project?
Yeah, this is just
and
about.
Is that okay that we would not, we would not have funds other than just what we're asking? So in other words,
right.
We would put then revenue projected for, we would put in for Kongalma, let's say we put 15 or whatever, 10,000, and then other on the revenue projected. If we say 0, then that means that we do not have, right?
Right.
Okay.
So this is only for the project that you are asking CONAMA to fund. So no, you wouldn't put other funding for other projects that you might have.
Okay.
However, what you want to do is somewhere in your narrative, there is a question that asks about leveraging other resources. It's important when you can't show other funding streams for a particular project that you explain whether there are other circumstances, right? In your case, Alma, you have the whole university and other departments and you know, all sorts of other things that come into play that provides you the structure and the capacity to move this project forward. So you want to speak to the fact that you will be leveraging the, you know, other resources. You have perhaps additional staff time that is pro bono, that is in kind, that is not specifically paid for by this project, but they're still there and they provide support for the project and things of that nature. One of the things that's really important for any application that comes to us or any other funder, really, most funders will look for other support that project has, because no, or very few, I should say, funders will want to be the sole funder on a project or an organization. It just makes for that project or that organization to be too vulnerable. And CONAMA, there's no guarantee that if we fund you 1 year, we're going to fund you again the next year. So we don't want to be, you know, the only funder who puts in resources. We want to see how that project or that organization is being supported by others. And so it is important to have more than one funder, but we understand, such as the case that Elba, you mentioned, where there is a larger organization that does support the program, but it's all, you know, almost volunteer time. You may even have students assisting. Well, they're not getting paid necessarily, but they assist the project. So that's how you come around to that. You might also put that in. For instance, you're asking, in the case of the case that you're talking about, if you're seeking 10,000, you might put in here specific salary for X, Y, and Z. You know, an intern or staff, additional or in-kind provided by X, Y, and Z. You want to be able to let us know that you're not solely depending on CONAMA for something. I hope that helped. All right. Any other questions?
Couple more questions.
Okay.
Just a quick follow-up to that question. So just to be clear, we do have the program under this fiscal, or the university, the program, we get multiple funding, right? But for this project, we would be only asking the support. So do you want, would that preference be that we, in the leveraging that question, list our other funders? Yes, okay. But there is a formal budget area where we would, because there are some foundations that request, what is your overall total program budget? And then what are you asking for this project? So that's where it goes back to you. You're right. You're not the sole, CONAMA is not the only funding agency for the program. So
well, if that's the case,
under the bigger institution, exactly.
Well, if that's the case, then you do want to put down, I misunderstood. I thought this was, in that case, you do want to put those other sources in here. Maybe your program budget is 200,000. You want to put down this. and what of that 200,000 is supported, and or is secured versus things that are pending, waiting to, you've submitted a proposal. I thought what you meant is that the department is a larger department budget, and that this is the only resource you're asking CONAMA is, and this is the extent of the project you're seeking. But if the program is larger, that's why we developed this, is to exactly understand the size of the project or the program and what aspect is being asked of CONAMA and what other resources are supporting that, and of those resources, what's secure.
Okay, sounds good. I think I got it now. Thank you so much.
Okay, thank you.
So we have 3 more budget questions that I see now, and more coming up. How do you suggest we do a budget if we're asking for operating?
Operating does not have to submit a budget. What we will look to is that uploaded your general operating support, your annual budget, that tab that I showed you. See, it's asking me to save before I leave. So let's just save it for the heck of it. I'll close. That's where this comes in. You will upload, if you're asking for operating support, all you have to do is upload your annual budget. You don't have to submit a specific project, because operating support is non-committal. We're not funding a specific project or action. We're supporting the organization.
Within the technical assistance grants, it says that organizations who engage in a consultant or other consulting collaborative partner to consider including a minimum of 10% of the budget. Yes. Is there a max?
To pay that contractor, but to keep behind some resources for your organization to actually participate in that. It goes back to that idea of active participation. $10,000, and the contract that you're seeking to engage in is $20,000, and you have other resources to pull from. Your need may be a full $10,000 in order to pay for that contract. Just let us know. That is not, that's up to you if you want to set aside some resources for your organization to be able to participate in, because it's good for you. But if you have other resources, or you have enough operating budget that you're going to cover your organization's engagement with the contract, and what you really need is the contracted amount, by all means put that in. It's not a make or break, it's just a suggestion for those organizations that may not have that kind of flexibility with their budget.
I think we need to decide, we have more questions than we can answer within the hour and a half.
Okay.
We'll have to revisit what we want to do.
Yeah, why don't I just continue with this really quickly, and if we have time right at the very end, we'll circle back with questions. So right here, I skipped over the attachment. We already covered it. You upload your annual organizational budget. And here is where you authorize the fact that the person that's authorized, that's able to submit the proposal, is doing so. So it's just a matter of completing that. And once you have everything done, this is where you want to submit your proposal. Once it's submitted, it becomes a PDF, and we cannot change it, and you won't be able to change it. So that's why I'm saying is wait. You can go in the system as many times as you want and upload information and type information, and always save it before you exit, and it'll go back to where you last, the information will be there, but whatever last thing you updated, it will be there. The last thing on here that I want to show you is the fact that you have a slew of resources at your fingertips, including the grant guidelines, and other things. Again, what we try to do is double up on, always will remind me to save it, which is a good thing, right? And now I can exit out back to home. So I'm going to stop this share and go back to really quickly. That's green. And now you can see my slide.
Yes.
And we've done this throughout, which has been good. So I will move forward. So next thing that we have on this slide, and I was going to go through a little bit more, but we won't have the time. But in any case, we've gone through a lot of this. In this PowerPoint, we've actually copied all of the questions that you would have access to once you start the application.
Now, we can see your notes.
Oh, great. That's always nice.
I mean, I'd love to see your notes, but yes.
No, that's so I don't get tongue-tied. Let's see. How do I do this then? Hold on. I want the actual.
And I will just add that we can definitely keep the Zoom line open if folks want to stay and ask questions or anything like that.
Okay, yeah, that sounds good. But all I was going to say truly is that can you see now the
yes,
the applications? So this is what we went through. That's the quiz question and all of the different questions with regards to narrative questions and drop downs of the two opportunities that you have available to you, and the authorization. You see all of that. So really, right now, what Dennis was going to do, and Dennis, we can either skip this or go right to it. Either way, is we were going to show you where to find this information on our website, or we can go back to the Q&A. It's what would you like to do, Dennis?
I'd like to do what's the most helpful.
Yeah.
Maybe in Q&A, if somebody wants me to go through this, they can ask for that, and then I'll go through it.
All right. So what are the other Q&A questions?
So I'm going to go with an earlier question. The application says to submit a fiscal year 2021, 2022. I can't talk. Or 2021, 2022 organizational budget. But what if your fiscal year 2021, 2022 budget is not yet complete?
Great question.
Drink water, Dennis.
You submit your current budget. So if you have a budget, an organizational budget, you want to submit that budget. What will happen is if you're invited to a site visit, prior to that, I will get back to you and ask for you to submit, even if it's a proposed budget for the coming year, for you to submit it. So at the current time, you want to submit whatever your current budget is, and if that is 2020 into 2021, the first half of that year, go ahead and submit that. And then later on, we will request one that goes into the latter part of 2021 and into 2022. I'm
going to jump to an old question, but different topic.
Okay.
If our program involves our student leaders in the systems change activities, we should also include them as volunteers on the diversity questionnaire.
Yes. Yeah, I would, because you want it to reflect who it is that is going to be engaged in your efforts, and especially if that is something that you do on a regular basis. You have volunteers, whether they're students or they're elders or they're whoever. You want to include them as well. So yes.
If awarded by CONALMA, can you retroactively pay for costs incurred in 2021 associated with the project being funded? Or do all incurred costs have to occur in the funding period of 2022?
The latter. Yeah. And that's why I said you need to be planning. This is about if awarded, it is about the upcoming year, 2022. So your budget, your expenditures, and the activities, the scope of work all happens during the implementation period if you're awarded. And that implementation period is January 1st, 2021 through December 31st, 2022. Great questions.
If CONALMA is 100% of the funding for X project, does that decrease likelihood of funding? In other words, does CONALMA want to see leveraged funding? And I think you touched a little bit on that, but.
Yeah, the answer is always yes. We want, and most funders want to see that there's investments and resources that support the work that you're doing, and that it's not just based on one funder, in this case, CONALMA. So yes.
And I think that's all the ones that I can find.
Okay.
I have another question, if it's okay.
Of course.
Hi, Nelson and Dennis. Thank you so much for hosting this.
Of course.
My name's Sophia, and I'm with Outrageous Outreach, and this would be our first time applying for funding, and I just wanted to make sure that we were a fit for this grant.
Okay.
We do education videos for school-age children, and we use the arts to leverage equitable access to the arts and education and support social emotional learning. And I'm wondering if that is within the scope of funding for CONALMA, or if you have any suggestions of what angle to take to seek funding.
I think in that case, and in many cases, it depends. It depends on how you frame the proposal. It depends on what you're asking CONALMA to actually, what the funded grant would be used for. So in something like that, what I would suggest is that you send me that paragraph to think about how you would approach CONALMA, and then I can provide some feedback around that, because so much of it really truly depends on those two factors: what it is that you're asking CONALMA to fund and how you approach the foundation. So it's a maybe question.
Okay. Well, thank you so much for being willing and having time to review those questions. More specifically, is we have an arm of the organization that's producing virtual content for students. Given COVID-19, a lot of students have moved to virtual classrooms. And we would seek project funding for a specific series of videos that would not be created otherwise.
Yeah, and again, it depends, because like, do you include, for instance, training for the teachers in how to approach and best practices on using those? That's a capacity question, right? And yeah, there's just a lot that it depends on the scope of what you're trying to do. Is there an aspect of this that is about outreach and making it available to areas of the state, school districts that otherwise would not have access? Is there an area of what you're doing to be culturally significant that you want folks from, I'm just, again, making this up, northern New Mexico, Navajo speakers, Navajo specific language and cultural significant information, that video, that you're going to engage elders and families to make that video. All of those things would be very much within CONALMA. But if it's very passive, we're making this video and it's going to be across everybody, and it's the same one for everybody, that's going to not be as compelling.
Right.
If you see what I'm getting at.
Thank you so much. I won't take up any more of the group's time with the specific questions, but I'll send you an email.
Okay.
Thank you.
Sounds good. Of course. How's everybody doing?
Nothing new on chat.
Okay. I hope this was helpful, and I'm sorry that it's a lot of information, which is why I really commend you for being here with us, taking the time to review, especially the guidelines and some of those materials that are included. It really will make a difference. And I really look forward to connecting with you. Thank you. I think we're a little bit past our time. We are 7 minutes. Robert, is there anything you would like to say as we wrap up?
No, I think you've included it. So what we'll do is we'll make sure that we link the slides and the video link once we have it processed, and we'll send it all to all the people that registered for the event. I know some folks couldn't make it today, or they had some trouble with the Zoom link, so we'll make sure that folks have those links too. We'll just link back to your website too. I saw Dennis's links back to the CONALMA website, so we'll include that. This was also on Facebook Live. You're welcome to see. Just look up for anyone out there, if they want to refer to it before we start to release the link within the next day or so. You're welcome to look on Facebook at Pivotal New Mexico's Facebook to access any of the information there. So, but other than that, I just want to say a big, huge thank you to you and Dennis just for taking the time today, and to everyone else in the audience for taking some extra time as well, just to also take in a lot of this information.
Excellent. Thank you all so much.
Thank you, everybody.